Okay, so let's talk a little bit about acceptance and commitment therapy. Um, it's an evidence-based approach to understanding patterns of behavior and stress using mindfulness techniques. It encourages what we call psychological flexibility, something that we will touch upon as we go through this session. Acceptance and commitment therapy uses a lot of value building, making committed actions, self as context, using diffusion, acceptance, and being in the present moment. So this might sound fairly confusing at this point, but we will take you through it and simplify all this jargon. I'm sure a lot of you know what ABA is. So I'm going to talk a little bit about ACT and ABA and what the connection between the two sciences are. ABA is a science of behavior that's data-driven, evidence-based, and I believe, is it the most popular method now? Yeah, the most popular method of intervention or treatment for ASD world over. ABA has its roots in the works of B.F. Skinner, and ACT, interestingly, also has its roots in clinical behavior analysis. So both ABA and ACT are evidence-based methodologies that are aimed at successful behavior change. Now, what is really telling after years of ABA and years of research into intervention for ASD is that parent involvement is a very essential component of effective intervention programs. Any intervention, anything, I mean, you can pick it. Is it speech, if it's ABA, if it's a Sunrise program, anything that you're in requires a lot of parent support and involvement. So research goes to say that this expectation on parents of children with autism spectrum disorder has been a significant source of stress for the parents.
Yeah. So high stress levels, when your stress levels go up, automatically your ability to function as a stakeholder, as a support for your child kind of lowers, resulting in limited involvement in the child's progress, which results in the child's progress slowing down, and so on and so forth. So high levels of parental stress is a given in a condition in many situations. So how to manage these high levels of parental stress is what can be done effectively using ACT.
So let's talk a little bit about the impact of an ASD diagnosis on parents. We've all been through it. It is not easy. And the way we look at it, there are three areas in which an ASD diagnosis affects parents.
One is social, for sure. Then there's the emotional and the psychological component. And I think a big part of the impact is also on the financial stress that it poses on the parents and on the family.
Okay, I believe our tech support is asking us to exit the webinar very briefly. I completely apologize for this, but I'm just going to exit, have a quick word with them as to what we have to do, and oh, hang on, it says don't stop, continue.
So, talking further of the impact of a diagnosis of autism spectrum disorder with the child and the family. First up, of course, there is the grief, the grieving of the loss of expectations, grieving of a loss of, okay, this is what I had envisaged of my child, a loss of that kind of an expectation. There's denial, maybe.
Denial, yes.
Yeah. There is the anxiety, there is the denial, there is the why me, then there is
blaming it on karma.
Yeah. Fate. Yeah. Sometimes you go back to thinking, mom probably thinks, what did I not do right? Yeah. Was it because this was a baby I didn't want? Or what, when all else fails, what did I do wrong in my last birth that is impacting me now? So there is just so much of stress and anxiety that is caused by a diagnosis. Once you're through with all that, here is a child with deficits and delays in social and communication milestones. Some of them may have extreme difficulties with feeding, sleep disorders, emotional dysregulation a lot of times, challenging behaviors, problem behaviors, externalization of problem behaviors, making it too hard for the family to actually do the things that they would normally do. And the stress on the parents, of course, the constant shuttling between one therapy and the other, the special education centers, the schools, so on and so forth. And of course, every therapist or every interventionist will, tell the parent, hey, these are my expectations, this is what I'd like you to do at home. And so the parent is actually burdened with a lot of expectations and a lot of home-based work that they're expected to do before the next visit to the said therapist. And at the top of it all is, of course, the social expectations and the pressures. Do I tell extended family members? How do I deal with my neighbors?
Who's going to play with my child?
Who's going to play with my
child? Do I send him to school?
Yeah. Do I send him to school? How do I do the things that I normally do? Can I take my next vacation, or can we travel by train? Will we be able to travel by an aircraft? Will this child go to school? What am I going to tell my family? How do I break this news to my parents? How do I break this news to my siblings? And should I tell those second cousins of mine who I'm going to meet at a wedding? And what will happen if they come and ask my child a question and he does not answer? So social expectations and pressures can really, really cause a lot of stress and anxiety in parents.
So if you will let us for a moment, we're going to ask of you to lower your eyes again. Don't look at the screen. Try and close your eyes. We're going to do a small mindfulness activity with you. This activity will last a minute. Can we get everyone to close their eyes, please?
So bring to mind the first time you got a diagnosis of autism for your child. Think of that one situation where somebody told you to please leave the premises because your child is disturbing us.
Or if it was a friend who said her child can no longer play with yours because he might imitate or learn the behaviors that your child exhibits.
Or the time that you went to a school, to a play school for admission, and you were told, sort out his problems. We are not equipped to deal with this. Bring him back once he is normal.
Remember what that felt like? That feeling of being denied, the feeling of isolation. Just remember what that felt like. If it hurts somewhere in your body, or if your throat is caught up, just keep in mind what that felt like.
Sometimes it could be that you felt something in your stomach, what we call the gut-wrenching feeling, or the anger, or you saw the color red when somebody told you that you have to leave this place, or your child is not fit to be here, or the fact that you went back to grieving and asking yourself, why me and why my child? And the stress and anxiety that came with that event or with that moment.
Gently open your eyes. Thank you for experiencing that with us. Thank you for allowing us to take you back to that place.
But social pressures, don't we all function under it all the time? What will they say, that elusive they?
Log kya kahenge?
So what comes to mind is what Steve Jobs said. Your time is limited, so don't waste it living someone else's life. Isn't that advice with good measure? That's to be taken with a lot of it.
So on that, let's go back to some of the stress outcomes that comes with the diagnosis of autism. Research by Davis and Carter goes to show that 39% of mothers of a child who just gotten a diagnosis of autism reported a clinically significant level of depression, with which comes anxiety. There is social isolation. parents start to realize they cannot take their child everywhere. They can't go for that weekend lunch at a friend's house.
Go for a movie that
Go
they
for
love
a
to
movie. Exactly, that they used to do every weekend because their child is rocking on the movie seat and that causing a disturbance to all the other moviegoers there.
Going for weddings. How often do we hear of parents saying, "Oh, we take turns and go." The husband goes for one event and the wife goes for another event because they can't take the child along with them. He's unable to handle the crowd, the noises, the food, and just the overload of things that go on, in an event like that.
Leading to like the husband and wife taking on very different roles, not being in it together, simply because one person has to constantly take care of the child or constantly monitor the child while the other has to go and take care of social obligations.
So this leads to perceived poor quality of life for the parents. It's like my life is done after this. This is the only thing I seem to be doing. There is social isolation. There is definitely financial strain as well. And a lot of times, like Swati said, one person takes on the burden of doing a lot of the stuff with the child. Sometimes a mom may have to quit her job if that's what it entails because nobody else is able to take care of the child. So it brings about a lot of significant changes in the person's life, a diagnosis of autism. And hence the stress outcomes can be
tremendously high. There's also loss of identity.
Absolutely.
Right?
Yeah.
Identity of self is something that is so integral and important to a person's well-being, which is somewhere lost in the process of bringing up this child and all the stressors that are related to bringing up this child. So this brings us to a term called experiential avoidance. You're going to hear a lot of it, so we're going to have Gita explain what experiential avoidance means.
It's simply avoiding a situation or an event which is uncomfortable or is going to be unpleasant for you in some ways, right? If let's just say you have a child with autism and he has a tendency to make these loud noises, or a child who can just be talking all the time, making these, and he won't stop no matter where he is, right? So you walk into a place where you're supposed to be quiet, or you walk into a supermarket or a store, and this child will make these particular sounds, and sure enough, there will be 10 heads which will turn around to see, hey, what's that strange noise that's coming there? And that does draw a lot of negative attention to yourself and to the child, right? So we often, once we've experienced it, we often avoid those situations, and we do this all the time in our life, experiential avoidance. It's a way to get away from those unpleasant situations I don't ever want to face again. So how do we overcome this? As a parent of a child with autism, what are the expectations that are foisted on you all the time? One, that you want to be consistent with the interventions that are being implemented with your child. And every therapist and every interventionist would have told you this over and over again. Consistency is important. It's so important to be consistent if you want to see changes. While yes, the willingness to be consistent is there in every family, in every parent, over a period, sometimes repeated attempts at trying to do something, and if you don't see even a sliver of success, right? Then what happens to your motivation to continue to do it?
Oh, it plummets.
Right? No reinforcement at all. No reinforcement. So that often results in you saying, this maybe this is not something that will work, and why would I keep doing this when it's not successful, or something happens and there's a little break, you never go back to doing it, and then you just kind of lose interest in it. We often see this, don't we?
We do. Yeah.
Parents come in with the best of intentions, but somewhere along the way they lose that momentum. And to continue to be consistent with what they're doing. Willingness to stay in contact with the unpleasant experiences. like I said, going out and your child has a meltdown, or your child throws a tantrum, there is some self-injurious behavior in a public place, or sexual expression like a masturbation, a child pull down in his pants in a public place. How uncomfortable is that? That is hard.
Deeply, it is deep. It is very difficult to be the parent of that child and to have deal with that. It's heartbreaking. But here's my willingness to stay in contact with that experience and to actually encounter that situation and tell yourself, fine, this has happened, but I need to go through with this. I need to come out of this. I need to help my child get not do this or do this. So as the case may be, it's like the pain we see in a parent's eyes when we ask them to ignore their child who is throwing a tantrum. It's very hard.
Or a child who's crying. Sometimes we don't know
Crying.
why.
We don't know why. They're not able to tell us why they're crying. But unfortunately, in some instances, we have to request them to ignore that behavior, which is especially hard for a parent.
Yeah. And what else do we expect? Patience. Patience in going through behaviors, going through strategies, going through planned ignoring programs, going through time outs as if it is necessary, going through everything that you're mandated to go through and not avoid the situation simply because this is a journey to teaching a child to be able to live in the world,
Fulfilling life.
fulfilling life, and be socially acceptable as far as possible. Use of positive parenting strategies. There are times when we can be very, very punishing of children, completely intolerant of children. That could be a day when we got out of the wrong side of bed, maybe,
Or
and
overreact to
yeah,
them.
overreact sometimes.
Yeah.
Look for that perfection. So anything that a child does that is not that perfect, you jump in and react. Or sometimes just being so lax, the child has no sense of limits and can actually ride roughshod on everything, much to the discomfort of people around them and the others in the environment. Right? So, experiential avoidance can come when you are unable to be consistent, when you're unwilling to stay in contact with these uncomfortable experiences, or when you lose the patience, or when you use parenting strategies that are not coherent or positive or not together, but just would be reactionary
Yes.
more than responding. So, what is the key then to succeeding in this whole journey?
A whole lot of patience. If you ask me, one of the things that ACT really teaches you through its methodology is patience. Accepting the present moment and being patient while you work towards your committed action. Progress for a lot of children who are affected by developmental disorder can be slow, but success is yours if you're consistent.
So, it is to be persistent in the face of doubt. Now, every time you see a behavior, you see a challenging behavior, you see something that you're trying to get the child to learn, or something that you're getting the child to unlearn and stop doing, there is always that doubt. Does he have the wherewithal to do this? Do I have the wherewithal as a parent to continue to deal with this consistently?
Will he ever get there?
Will he ever get there?
Yeah.
What if it gets worse?
What if he regresses?
What if he regresses?
Yeah.
And on the other hand, sometimes we have expectations that are sky high, where we have already set up everything for failure. We have set up the situation for failure because we expect from the child something that is way beyond what he's able to do. Right?
So that brings us to a place where we're so worried. We're constantly pressurized and worried about our child. Will he ever learn this? Will he ever go to school? Will he ever do this? Is this therapy even helping? Is he ever going to talk? Is he going to have friends? And we just worry and worry and worry.
So one of the things that we talk about in ACT is mindfulness, which is, do you know that 50% of the time, according to research, 50% of our waking hours of all of us is spent somewhere else. As in, we're physically here,
Mindfully elsewhere.
yeah, our mind is elsewhere. Like the pasta to the tight dress to my weight gain. We're thinking of X number of things, good, bad, and ugly. So there are memories from the past. There are things about the future. So those occupy most of our waking hours, and we have very little time where we are really in the present. So if you look at the worry circle of will this child ever make it? Do I have the tenacity to do this? How much longer do I have to do this? When will I ever, get a chance to breathe? When will I ever get a chance to live the life that I want to live? Once you get into this loop of worries, then you are moving away from your current moment. You're moving away from your stated values.
You're moving away from the possibilities.
Of the
That your child can be happy. Your child can learn. Your child can live a very fulfilling life. And the possibility that you and only you can make this happen for them.
It is hard, but yes,
you can do
we
it.
can do
You, as their parent, have every ability to give your child the most fulfilling life.
So, what is the goal of ACT? The goal of ACT is to increase psychological flexibility, the ability to actually connect with the present moment where we are now as a fully conscious human being, and to change the way we think and align it to what we call our own value systems. If you really looked deep inside you, what is it that matters most to you? And that is your value system, which is often lost in the process of, like we spoke about, social pressure.
Yeah,
society
in the the whole pressure of my uncle said this and my neighbor said this.
The other parent said this.
The other parent in the waiting area said this. There's so much pressure that you are taking on and adding, and that is taking you away from your own value system, one that wants the best for your child.
And ACT covers 6 core processes, which we saw in one of the earlier slides, which is like mindfulness, being in the present moment, committed action, value systems, and so on and so forth. And each of these is required to establish a positive bent of mind for the individual.
So this brings us to how can ACT help my child? There's a beautiful quote by Dr. Temple Grandin where she says, there needs to be a lot more emphasis on what a child can do instead of what they cannot do, which is really beautiful if you think about it. So let's do a little bit of perspective taking and start looking at things from your child's point of view. Close your eyes. Don't look at things from your point of view like you always have so far. But let's start looking at things from your child's point of view. Do you have any example you want to share for that?
Just so many, but oftentimes we are really, really so bound by other pressures and we stop seeing this child as a child. He always becomes a child with autism, a child with so many problems, a child that needs to be fixed. So if you spoke to a parent and said, tell me something about your child, the first things that will come is he cannot do this, he cannot talk, he cannot report, he cannot express himself.
He has no sitting tolerance.
He has no sitting tolerance. He does not know how to eat on his own. He doesn't indicate if he wants to go. So a lot of no's, a lot of things that he cannot do. Right? So we are always in the pursuit of trying to fix things that the child is unable to do. But what about all the things? What about the things that the child knows that the child has? He's a beautiful child. He knows how to explore certain things. He enjoys certain things. What does your child enjoy doing? Oh, nothing. He's all the time running up and down or jumping up and down. Is he enjoying doing that? Yeah, maybe. Yeah, so that's a good starting point. So actually turning around, and we are not mind blind, unlike children with autism. That's what they say.
Yeah. Or claim to be.
Yeah. So we can actually shift our perspective and try to look at things from the child's point of view. Because here you're looking at building a value system that resonates with you and that resonates with the child, and not one that resonates with the rest of the world. So intervention and parenting needs to be child-centric, breaking free from social pressures.
Every child has strengths and weaknesses. Believe it, believe this, every single child that has come in and seen us has amazing strengths. Just like he's got weaknesses, he has strengths. So that is where it is your job as parents, and it is our collective job as a community to focus on where he is today, right now, and then lead him up step by step to where he needs to be, where he wants to be, and not just push him into a marathon and say, come on now, run.
Yeah. So our job is to actually work in tandem with the child's value system and make sure we're setting him up for success. Because right now, more often than not, we're setting him up for failure and setting ourselves up for failure with our unreal expectations.
So I hope all of you can see the PowerPoint, because there's a little caricature up top which says there's a little circle where the magic happens, and there's a tinier circle which is way outside which says your comfort zone. So the ACT approach actually pushes you right out of your comfort zone into that space, that minefield, that amazing, golden space where magic happens. Magic happens for you as a parent, you as an individual, and in turn for your child.
Yeah. So accept whatever emotions you're feeling now and accept the present moment. Connect the things that are most important to you, which is your values, and commit to take action that will make these values come true, which really often means stepping out of your comfort zone or those little circle of thoughts which keep buzzing in our heads, which lay limits to what we can do. So if you can take one step out of that comfort zone, that's where the magic happens, and that's what ACT is all about, taking that step.
So for an example of a value, can anyone use our chat box and send us one thing that is very important to them? It could be anything.
I hope you guys are hearing us.
I know. I don't see any responses. One thing that is super important to you as a parent, as an individual, anything. Okay, I will put the chat box on hold and move to the next screen. There's a very important reminder that comes to us in ACT, which says, sorry, tech issues. There's a very important saying in ACT which says, giving up on your goal because of one setback is like slashing your other 3 tires because you got a flat. So this is a reminder that if things don't go as per plan, if your child hasn't joined school like other children of his age, if your child hasn't started speaking, if your child's intervention has not given it the results that you wanted for him, don't give up yet. Don't slash the other 3 tires.
So this is something that I'm sure all of you can relate to. What would happen if the autism gene was eliminated from the gene pool? You'd have a bunch of people standing around in a cave, chatting and socializing, and not getting anything done. Isn't that true of the children with autism? Their tenacity, their insistence on completing a task, and their ability to stay focused on what they're doing, and not get distracted by the many things that are happening around them. So we would have a lot of people who are having fun and enjoying life, but maybe not much work would get done if there were no people with autism
So we have to celebrate that neurodiversity that our world needs.
We have some
We have some answers. Thank you, guys. So someone says one of the things that they want most for their child is communication. That's what they value. I love that answer. So let's talk a little bit about what do you do to make your values come true? What kind of action you can commit to make your values come true? What do you suggest?
So let's take communication.
Yeah.
If this is a child who till now has not said a single word or has no means of communication, so for the parent, it's going to be about the emotions at the present moment are going to be definitely anxiety. Is my child going to be able to talk? What if he cannot talk? How is he going to manage to live life? How will he be able to tell me if he has a stomach ache? Or how will he be able to report to me if he wants to say something? How will he be able to live life later when I'm not there to interpret everything that he wants to? So the worries around that can lead you from where your child is till he is, as long as you are alive and he's alive. I mean, we can extend this so much. So accepting that you are feeling like this at the moment, at the present moment, how can we connect it up with the value that you have of communication? What is a committed action that you think you can take in order to make this value of communication come true?
Work with your therapists very closely, with your ABA therapist, speech language therapist, whoever, as the case may be.
No experiential avoidance.
No experiential avoidance. Don't run away from the fact. Don't say, no, he can communicate. He just does it when he wants to.
I understand him.
I understand him. That's enough. Don't say that, because the whole world needs to understand him. Don't avoid getting that consultation. So
committed action, persistence. We spoke of persistence. We spoke of consistency.
Yeah, let's work consistently every day of the year, including Sundays, on getting our child's communication skills up.
So committed action towards values, being mindful of the fact that you are doing this and not letting your mind flit in worry to the future. Or I know there are parents who said, oh, he used to talk when he was 1.5, and I'm yearning for my child to be like that again. So where we are anchoring ourselves to a specific goal or a very, very specific outcome, we are bound to be disappointed. But if we can deal with each day with commitment and consistency and persistence, then you are acting towards getting your values coming true.
Yeah. Adding to the point is if okay, I will answer. I see a lot of questions popping up on the screen. We will definitely answer them. Thank you for all the questions. It's a whole bunch. I promise you we'll finish up and answer them.
So the only thing that we all of us have in common, there's only one thing, and that is our differences. That is our differences. So diversity and differences is the only thing that we have in common. It's just opening our minds, having enough psychological flexibility to accept neurodiversity,
Celebrate it,
and not norm our children against somebody else,
against standards.
For the child is his own norm, and we work with the child from where he is and take him up step by step and accept that each one of us is different, beautiful in our own ways, and
there is no average to compare him to. What is that average anyway?
Yeah, there is no average.
Yeah. None of us are average. None of us will fit into that.
There is that wonderful book on averages.
Yes, which we will also share in an email, The End of Averages. Go read it.
To do with our education system, but that's a different story for another day.
So we're going to just take you through a little mindful activity once again. And we really hope you will join us for webinars in the future where we will go into deeper subject matter of ACT. This was just to give you an overview of psychological flexibility and acceptance. Gita will take us through an exercise now.
So let's go back to putting everything away, our devices, our pens, and our notebooks, and all of that, and sit yourself comfortably wherever you are, and I'd invite you to close your eyes. If you don't want that, defocus, look down, whatever works for you, and just think about what we have spoken in the last 1 hour. Think about your values. Think about what is it you would like to change in yourself. Do you see the strengths in you? Do you see your abilities? Are you willing to take that step out of your comfort zone? So close your eyes and go over this, being in your mind, being aware that you want to be here in the present and not in the future or in the past. Remember to breathe. Remember to keep focusing on your values. You matter, your family matters, and your child. Remember to keep social pressures away, and remember to take perspective that is from your child's point of view, and think about the things that we are doing now for our children. Are they on the right path? Are they on the path to the values that some of you have stated in the text box? Are they going to lead your child towards achieving these values for themselves? And is it going to make your child a happy individual, someone who can live, be independent, and be happy?
Thank you for giving us your attention today. We're quickly going over a lot of questions and comments that you have put up on our chat boxes. Somebody says, I'm sorry I'm not reading our names. There are many, so I'm going to skip over that. But one of you have asked if there is an ACT course for parents or professionals. There are ACT courses available. However, they're restricted at this point to America, Australia, and occasionally Europe. We hope to bring ACT to India in a very big way, considering we live in the heartland of mindfulness. It is a beautiful science, and we hope the course will come to India, but as of now, it is only available in the West. Yes, we can definitely give you a practical demonstration on our next webinar, which will be more in-depth into the subject. How to make a younger sibling accept and respect a child with ASD? That is a very, very useful question. Thank you for asking us that. I would urge you to take a look at some amount of desensitization counseling.
Definitely counseling a child, yes.
Taking the younger sibling for some counseling. Look for sibling social support groups in your city to see if there is a place where, I know Chennai has quite a few of them, where individuals with autism and their siblings hang out every weekend. So look for something like that. How can we teach communication skills?
That's beyond the scope of ACT. So getting into the territory of
ABA. You're stepping into ABA.
Topic for another day.
Topic for another day. I apologize. It's only because there's so much to answer in that we'll be running out of time. You can mail us. We put in our email IDs. Mail us with this question, and I assure you we will answer.
I love some of the values that some of you have put up.
It's beautiful. Someone says respecting the child's autonomy, and the other one says happiness, and I think that's wonderful. Independence. Want my child to be happy. That makes me so happy. Thank you for saying that. Somebody says, is Respirodon syrup good? I am sorry, we cannot comment on that. You will need a doctor, a medical professional to help you with that. Okay, there's a whole lot of questions coming in. I completely apologize. Isn't communication the domain of speech language pathologists? Hang on, I'm just going to your question. Why would an ABA therapist have to be consulted? Okay, wonderful question. Thank you for bringing that up.
Again, out of the scope.
Out of the scope, but I'll tell you in a real quick line, communication is the core focus of ABA. A speech language pathologist can help, but will help you with vocal speech, and ABA therapist will aid you with all types of communication, which could be PECS, which could be speech and sign language. Sorry, went out of the scope of ACT. Please share the PPT, we will do that. Okay. All right. Okay, we have a whole lot of other questions. Please email all of them to us. We are running out of time and we have to exit this webinar. But once again, thank you all for coming and just hearing what ACT is about. And we look forward to seeing you all in our more topic-specific ACT.
Yeah. Thank you so much for joining us this evening.
Bye.